Roughly 8.4 million Americans, that's around 11% of Americans, depend on insulin every day to manage their diabetes. Even with this many people taking insulin, it is one of the least understood medications out there. And in fact, people are often fearful of insulin because of what they've heard about or because of something they've experienced in a family member in the past. I know for me, my great grandmother had a below the knee amputation. And for a long time, I thought that it was something to do with the fact that she was a diabetic and she was on insulin. And that is something that has permeated through a lot of families and a lot of generations, but that is not the truth. So I want to make sure that we hopefully help make insulin make a little more sense for you in today's video. My name is Takova. I'm a board certified ambulatory care pharmacist and an educator. And today's video, we're going to talk about insulin. In this video, I'm going to give you 5 separate things to note and understand about insulin. The first, what it's for. The second, how it's used. The third, what are some side effects to look out for. The fourth, some pharmacy-related pearls or thoughts. And then 5, some tips, just some real-life tips and things that you can walk away with. So let's start with what it's for. So insulin can be used in a number of different settings, but the primary reason is for diabetes. And so this can be individuals with type 1 diabetes or type 2 diabetes or gestational diabetes. And again, there are some other things aside from that, but those are likely the top 3 reasons why you would be watching this video or why you're on it. For type 1 diabetes, those people are individuals who do not make any insulin at all for themselves. And so we have to give them all the insulin that they're going to get through the shot. For individuals with type 2 diabetes, this means that you likely are still making some insulin for yourself, but you may not be making enough. So we need to give you some insulin. And then in individuals who have gestational diabetes, meaning they're pregnant and they have diabetes just during their pregnancy, then there's just some hormonal things going on there. So we give insulin during the pregnancy to help keep blood sugars at a normal rate. So now let's talk about how insulin works. I kind of mentioned this before when I said your body may not be making insulin, but normally our bodies make insulin. So our pancreas produces insulin all throughout the day. It's giving us small amounts of insulin. But when we eat something, especially something that's going to give us a high amount of sugar in the bloodstream, like white bread, for example, then our pancreas gives us a spike of insulin to help cover that meal. And what insulin does is it acts like a carrier pigeon or a taxi or a carriage, whatever it is that takes things from point A to point B. And in this case, insulin takes sugar from the blood and puts it into different cells throughout your body. This could be your brain. We need some level of glucose in our system in order for our brains to not feel foggy, for us not to feel angry or hangry. It could be taking sugar into our muscle tissues, just all the areas of our body, so that we can use that sugar for energy rather than allow that sugar to sit in our bloodstream. So if you are an individual who has diabetes and you may not be making enough insulin or may not be making any at all, you can imagine now we don't have any cars or carrier pigeons to carry that sugar from the bloodstream and put it into the cells. And so that's where the insulin that you are prescribed comes into play. And we are able to give you that insulin through a shot. Because insulin is a naturally occurring hormone, there really aren't a ton of side effects with it. But one thing I do want to let you know is that it can definitely lead to low blood sugar. So if you have given yourself too much of a dose, if you give yourself insulin and then you don't eat, especially our quicker acting insulin, which I'll talk about in a moment, then that could give you a quick or rapid drop in your blood sugar. And that is a lot more dangerous than a high blood sugar in the short term. So you want to make sure that you aren't doing things that are going to lead to your blood sugar being too low. That could lead you to go into the hospital. I dealt with this personally with my grandmother, who ended up in the hospital with a hypoglycemic coma, and she didn't recover from that. And so just taking her insulin and then not eating anything. And I just didn't know the education that I know now to be able to talk to her about that. So if you don't take anything else away from this video, do not take your mealtime insulin without eating quickly within 5 minutes. The other side effect might be weight gain, especially if you're taking the insulin over a long period of time. In the short term, not as big of a deal. In the long term, because we are modifying the amount of your hormone and just the way that insulin affects the body, it can lead to some weight gain down the road. Now, a pharmacy tip I want you to keep in mind is that there are a bunch of different types of insulin. So we break them into two big categories, which are basal insulins and bolus insulins. The basal insulin types are the ones that are given that will give you a little bit of insulin throughout the day. That just helps to keep you at bay, just making sure that everything's going smoothly the way that it's supposed to. And specifically, it's the one that's going to affect the blood sugar right when you wake up in the morning before you've had anything to eat or drink. So hopefully that basal insulin is going to keep you at bay. The types of insulin that we use for basal are going to be things like NPH insulin, or we may use Lantus or Levemir if you've heard of those particular branded products. And then we have our bolus insulin. So these are the insulins that we give in order to cover for that spike that we need right after we eat. So if your body's not giving you enough of a spike, then we can give you a quick shot of insulin around mealtime so that when you do eat, that insulin's there and ready to cover that meal, grab that sugar, put it into the bloodstream, or put it into your cells for energy. And the insulins that fall into that bolus category are things like regular insulin or Novolog or Humalog. And so that's all I'm going to say about that right now. If you want more information on the different types of insulin, I could break them down a lot more. Let me know in the comments below. Happy to talk more about it in a different video. For this video, we're going to move on to some real life tips to consider. If you're on insulin, you've already been told to check your blood sugar. Please do that. Even if you just check it once in the morning, fasting, before you have anything to eat or drink, it is very helpful. And not only should you check it, but you should write it down or log it somewhere, because bringing that log to your doctor's office, to that visit, is the most accurate way that we have to know how to adjust and modify your insulin dose, or if it even needs to be modified at all. Now, we can also get your A1C level, and if you are living with diabetes, I know that you've heard of that number. That A1C blood test tells us how your blood sugar has been running over about a 3-month period. So it gives us an average of that in the form of a percentage. And so we're aiming for that number for most people to be less than 7. And we can adjust your insulin based on that number, but it's even better if we have a day by day, point by point, throughout the day how your blood sugars have been running. So take your blood sugar log to your doctor's appointment. One thing that makes checking your blood sugars easier these days are the continuous glucose monitors. You just slap it right on. Oftentimes comes with an app on your phone, things like that. And a lot of insurances cover it. So that's another thing. If you want to hear more about that, let me know. But ask your provider, ask your nurse at your next doctor's visit, or if you are lucky enough to have a pharmacist in your clinic, ask your pharmacist, and we can probably look into whether or not that continuous glucose monitor is covered on your insurance. And finally, for a last real life tip, make sure that you are rotating the injection site with your insulin. If you decide to give your insulin in your belly, which most people do, give it at least an inch or so from the belly button, because that belly button is kind of considered a scar. And we don't want to give it around or in any scar tissue, but give about an inch away and rotate the sites every time you give an injection. This is helpful because it reduces um, having scarring in that area, and then also just make sure that you reduce any adverse reactions that could be happening. Some individuals may give insulin in their thigh or the back of their arm. That is not as common as giving it in the belly. But if you are someone that does that, just stick to that same site. For example, you wouldn't want to give it in your arm one day, your belly the next day, your other arm, and then your thigh, because the absorption or the way that your body takes in the insulin in those different areas is going to be different because of the amount of muscle and fat that you have in those areas. So wherever you give it, preferably the belly, stick to that area. So that's all I got for this video. Those are my 5 areas for 5 facts that I feel like you need to know about insulin. I could talk on and on and on about insulin and go into a lot more depth about what they are, what the different types of insulins are, and how they are used in a complete treatment regimen. So if that's something that you want to hear about, let me know. Drop a comment in the comment box below and just engage with this post if you enjoyed this type of content. I will be doing more meds in 5 in this series, so please stay tuned for those videos. Hit the notification bell so that you'll know when I upload medications about blood pressure, blood sugar, heart failure, prostate issues, all the things I'm going to upload videos about And yeah, let me know if there are any specific topics that you are curious about when it comes to medications, whether it's prescription medications or over-the-counter medications or supplements. That is what I'm here for. I want to be the community's pharmacist. Thank you for watching to the end, and I look forward to seeing you in the next video.